Welcome back to The Short Coat, coming to you from the amazing and intense world of med school at the University of Iowa Carver College of Medicine. I'm Dave Etler, but that's not important right now. It's coming up on National PA Week when we celebrate physician assistants / associates, the besties, the fam, the bros of MDs everywhere. Speaking of bros, say hello to my co-hosts. PA2 Abby Crow is here.
What's up?
PA2 Emily Mazzeo is here.
Hello.
And PA1 David Walker Hoffbauer is here.
Happy to be a bro.
And PA1 Jake Groh is here.
Yeah, Grow bro, I guess.
Grow bro. Let's turn our attention to what you want to do with your careers. I know PAs have more flexibility career-wise. But they also have, I think, more scope of practice restrictions than an MD has. Is that kind of an accurate way of putting that?
Yeah, I think that's a good way to describe it. Realistically, day to day, it might not manifest as much as people think. PAs can prescribe, diagnose, treat conditions. They can assist in surgery. So in terms of scope of practice, it's very similar to an MD. However, a huge benefit is that we're collaborative. So where an MD might not have to collaborate with any other colleagues, although they may.
I feel like they do.
And they certainly do.
Yeah.
They're just not legally required, as a PA might be.
I see. Oh,
So
legally.
And that might even be state dependent.
And that's
Yeah.
state dependent
It is,
now.
yeah.
So in Iowa specifically, after 2 years of practice,
2 years.
you no longer need an MD to sign off on your charts.
Mm.
Whether or not you've actually discussed the patient with the MD is practice to practice dependent. But in terms of who has to look over your patient charts, an MD usually has to sign off on it, which is kind of becoming an issue in terms of volume. And there are questions about whether or not this is just a legal restriction or whether or not it's helping keep patients safe, which is why there have been certain states that have removed this requirement from MDs. It's like kind of a burden. It's a logistical burden for
Yeah.
a doctor.
And I don't know. I think the primary reason for doing away with some of those is to sort of increase the availability of healthcare
Of course.
within a state like Iowa, which is largely rural.
Mhm.
Interesting to note that the PA profession has grown 27.8% in the past 5 years. And the Bureau of Labor Statistics projects it's number 10 in the top 10 fastest growing occupations in the next decade, which is pretty cool. There are 189,907 board certified PAs as of the end of 2024. Are there non-board certified PAs?
I don't think so.
Okay.
I mean, there may be.
I don't know how that works.
I don't think so, because like I know that like this is a much different job and scope of practice, but like you can operate as an MA without an MA license and then you can actually like
Oh yeah, I did
literally
in New York.
just
I made a face, but I did
Yeah.
that.
no yeah you can literally just become an MA. I think it's after 2 years of like not or of just like practicing in an MA role. Like I don't know how
It's
in
state to
Colorado, yeah.
Yeah, but yeah, I don't think there's anything like that for PAs.
Mm.
So I think you kind of gotta do your pants and go from there. Yeah.
Pants is PANCE.
Yes,
Correct.
not PANTS.
I for a long time I thought it was PANTS.
Yeah, do not do your pants.
That's
So-
Well, do your pants.
Well, do your
please.
pants, but don't do your pants. You know how it is.
what is pants? PA National Certification Exam.
Yeah.
I mean, I'm just definitely excited for the growth opportunity as a PA, knowing that out of PA school, I'm going to be so employable in many different jobs. I hear graduates from Iowa talk about like, yeah, if I knew I wanted to work in a certain specialty, I'd look for jobs there. Or if me and my partner are moving to a new city, I can just find a job so much quicker and easier. And I'm really excited for that coming out of school.
Is there a specific subset of medicine that you're interested in?
I think I definitely want to see what I like on clinical rotations. In my preclinical experience, before PA school, I worked at the hospitals, but I was a float nursing assistant. So I worked in 30 different units at the hospital. And I realized, like David, I just like lots of different kinds of medicine.
Mhm.
I like all the different things I can do, learning new things. So right now, I think I want to work in maybe emergency medicine or family medicine, somewhere where I can see tons of different things every day, still be somebody who's like kind of in charge. Like I can walk in the room and have that, I keep saying authority. feel like it's
Autonomy, maybe?
I know, autonomy is a great
Autonomy.
word.
I like that.
Autonomy.
Yes, it was still.
I have
chicken.
authority.
Respect my authority.
Which is something you can do. Like you mentioned, most emergency rooms now are shift work.
Mm-hmm.
So you're, 8 12-hour shifts. You only have to work 3 a week. So if you wanted to see patients in family med the other 2,
Mm-hmm.
that's something that you can totally do. Which
I know it's totally unlike
It's like-
MDs.
Yes.
It's amazing. I think that might be why it is such a fast growing profession, is because people are starting to realize that the work life balance with a PA is far more enjoyable than the work life balance of an MD. And I mean, nothing against them. That's
Oh.
fantastic what they're doing. We
Need
need
it.
them.
We need them.
Mm-hmm.
But it does have a certain draw, just knowing in the back of your head, if that's something that you choose later in life, the PA profession is going to allow you to have that family and that work-life balance.
Yeah.
Or if you feel burnt out after like 10 years of doing the emergency department, which is what I'd wonder if I did that. If I could go to clinic work or totally switch
Exactly.
up my career.
Yeah.
So,
And then
Orthopedics,
even
pediatrics.
And even
Lot of
after
help.
graduating, you have opportunities for residencies, and you can like subspecialize,
Mhm.
in the loosest quotes imaginable, if you want to. So like Iowa has an emergency medicine residency that I myself am like very interested in. I loved being a medic. It was awesome. You got to see a little bit of everything. So I'm
Mhm.
with you. But it's exciting that we also get the chance to do, at least for me, something that's like completely different, like peds or OBGYN, where most of my patients were like military-aged males with boo-boos and stuff like that. So being able to see something like more complex or deal with a completely different demographic of people,
Mhm.
that's exciting. And then I was a completely different demographic of population-wise compared to Georgia, Florida, Tennessee, the different places I've lived. So those are all super exciting. And then the fact that I know I'll have a great job, I'll be employable, I'll be able to do what I want. If I get bored, I can just change it up, or if I get burnt out, which it happens.
Mhm.
So it's a really, really exciting time to be kind of heading in this direction. And I think that we're
Absolutely.
riding the wave at its like crest. I feel like
Yep.
we're at the best time to be a PA. Not that it hasn't been great to be a PA the entire time that the profession's
Just
been
a little
around.
bit post-COVID, maybe.
Yeah,
Right.
we're starting to
Yeah.
kind of get back to where we were a little bit, catching up on some of those like appointments that have been like deferred and all that, and the funding. But yeah, it's exciting. It feels like it's a good time to be getting into medicine professionally.
Right. Yeah.
So something you guys mentioned was, well, 2 things, I guess, residencies and then subspecializing. If anyone has any, these are kind of hot button topics. Residencies are popping up
Mm-hmm.
more and more. Iowa does have the emergency medicine one.
Yeah, I
which is
think they have
kind of
one
rare.
more.
Family med,
Okay.
definitely.
Family medicine. I want to know if anyone has any opinions on that. Like, should PAs do residencies? Is that
Yeah, what's it for?
Go for it.
And you can definitely speak up, Jake, if you know more too. But I was also looking into doing a residency for emergency medicine. Basically, you will join medical residents on their journey. And like at Iowa, you will just be one of them, rounding, doing all of the same things, but it's allowing you extra, like more individualized time almost as a student.
Yep.
Where you usually take about like half pay at Iowa, you would start around 70,000 per year during your residency, and it's 18 months. And they pick 2 students every year, maybe 3, and you're able to practice skills. And I see most of the value in emergency medicine when you have such high acuity, some of the areas with the most maybe lawsuit potential. And when you come out of PA school, I think we've been learning so much information on a broad scale. It's great, but when you're actually doing the medicine, sometimes I get scared for myself. Like, do I have the competence and the confidence to do all these things on my own? Or would I benefit from some more of that individualized practice time with other supervising doctors who are teaching me and doing these things? So
Yeah.
I think people see it as a way to practice, get better, still make a salary, and hone in on some like special skills. Like we have a PA who did the fellowship, and she did a extra time in ultrasound, so she's really good at ultrasonography, stuff like that.
Yeah, and it has some like tangible benefits too.
Love that.
Where our title when we pass the pants and become licensed PAs is PAC, and when you complete a residency you get a nice little comma after that PAC, and you can get like EM, like peds, like that kind of stuff attached to it, so it's a part of your title as well. So when you're applying for jobs or you're looking into getting into like a particular specialty, you have that nice little like end piece like attached to it that really shows people a lot of more about like, what your interests are. I mean, I feel like that could say a lot about you, and it can tell people a lot about your skills too and what you've learned how to do. Because I'm kind of the kind of person who enjoys like the school of hard knocks. I'd rather learn by actually working with patients and stuff like that. So, didactic's been a lot of fun, but I'm kind of getting a little antsy already where I'm like, I want to,
No.
yeah, like I miss, I miss my patients and stuff like that.
Yeah,
So,
that's fine.
it's been great, like having the simulated patients in our CAPS program, clinical and professional skills. And I feel like the residency gives you an opportunity to do that without having a job on the line potentially. So it's kind of like a little bit of a safer like jumping off point, at least to me. That's how I view it, and that's why I'm personally interested in it.
And just to play devil's advocate there, a lot of people argue that your first year being a certified PA should be a learning experience, and you should be able to negotiate with your employer the education and the further career development that you have paid for, have gone to school for, whatnot. So there are some people that argue that residencies are kind of shifting that PA unique experience to more of an MD.
I know. I was thinking about that too. And also, one of the things that we think about with, when so we write this MSPE, this medical student performance evaluation in the fourth year for MD students when they go to apply for residency. And one of the things we're really careful about in that MSPE is not talking about what specialty they want to go into, because the MSPE follows them, which to my mind suggests that people might see, say, emergency medicine. If somebody wants to be a career changer someday and decides crazy to go back through residency, people might be, well, this is an emergency medicine person. Why do they want to go to psych, or why do they want to go to, some other place? I don't know. I just worry about whether it's going to unfairly pigeonhole some people and, like you said, take away one of the more cooler aspects of being a PA, which is you can do whatever the heck you want.
And I think, like Abby said, I think it works for certain specialties, because emergency medicine, on your first day, you could be alone on a case, and that's scary, and you might not know what to do. So you get this kind of buffer. But say if you're going into maybe
Like urgent care or something.
urgent care, family medicine, something that's a little bit less acute, you have that time to learn and that space to learn. And I think PAs were supposed to be trained generally, and subspecialization is kind of something that we're seeing a lot more, and which is a great thing as well. PAs have their space in a lot of fields, but just keeping our minds broad and keeping our training at heart.
Where do you guys think the profession's going in the next 20, 30 years?
Have you guys become associates yet?
Okay, so that's the problem is
Every year we have a PA week show and I ask the question. So I got to ask it again. Are you guys associates yet?
not yet. Like, we couldn't put that. It's not going to be on our license.
Okay.
So you can go by physician associate. That's like a kind of semantic thing at this point.
Yeah.
But it's not going to be on our license.
Yeah.
So
Legally, we are
legally.
still physician assistants.
All right.
So until that changes, call us whatever you want.
At least in the state of
So-
Iowa, right? It's state specific. Because I think one of my friends going to University of Oklahoma, their program does say physician associate. So maybe in Oklahoma, the state licensure will look different. So
I don't think it will still. I think so, like school by school. The University of Iowa could become the physician associate program at the
Right.
University of Iowa, but they won't make that change until it'll align with our
right.
And that's an interesting conversation too, because we already have a lot of confusion surrounding our name, and patients are kind of maybe just now learning what a physician assistant is. So if we kind of mix it up now,
Yeah.
Exactly. There's
So-
a lot of ambiguity.
Yeah.
mixed
still
emotions for
with-
sure, whether or
with
not.
career.
At least we're getting over the apostrophe S thing.
Yeah.
Assistant to
I am no
physician,
one's
we're not that.
assistant.
We're not
Yes.
that.
Yes.
Yeah.
Yeah, when I was growing up, as I said, my dad was a PA. It was physician's assistant,
Mm-hmm.
Oh,
Mhm.
I think.
Yes. Yeah.
That's how I always
Originally
heard it.
started it. Yeah.
Yep.
because the
So-
first one was a physician's assistant that was like, oh, you are doing everything I can do. I've trained you well.
Mhm.
Yep. That
You
first
were-
class at Duke.
Those 4 men.
Navy corpsman.
Mm-hmm.
Yes, just like you.
I was not a Navy
Not in the
corpsman.
Navy though.
Thank
Well.
goodness.
Service
gosh.
member.
Service.
Yeah.
Yeah, I feel like the profession only being 50 years old, I think originally and starting to fill gaps in rural healthcare and specifically family medicine
Yeah.
in the southern states predominantly at first. I feel like when we move in the future, I would love for PAs to still provide a lot of that generalist care, like either moving into more family providers as a baseline or just retaining that flexibility and not subspecializing so much. I think I can see the role of MDs becoming very subspecialized so we can have very specific eye surgeons or chemoradiation doctors, but then we can have PAs as front people with a lot of patient interaction, still able to provide good medicine and care. But
And I think like I mentioned earlier, I'm just a naturally curious. Like I like to see how things play out. So I'm excited to watch the PA profession play out. There's all this new legislature coming about in every state right now, especially I know Colorado just passed a similar law that Iowa did, allowing a lot more autonomy after a certain amount of time. And it's just going to be exciting to see like what legislation comes next and what opportunities like are we going to have even in 5 years. Like we'll be licensed by then, but what's it going to look like in 5 years? That's cool. That's exciting. And I'm
Yeah.
curious.
Yeah.
So
I mean, they've already added in legislation, and I think it's like 6 or 8 states where PAs can now own a practice without a
I don't know
supervising
any.
physician. And I don't want to name the state specifically because I don't want to put bad information out there, but a lot of them have like very large rural populations.
yes.
which is great.
And that's exciting because I feel like opportunities like that to own your own business, to create a base of patients that you treat and you get to know in whatever, subspecialty you choose to focus on. I feel like that will draw more people to the profession. It'll make people realize like, hey, I have an opportunity to really like create a good life for myself and build like a network and really get into medicine in like my way. And I feel like that's one of the like exciting frontiers that we're starting to get to. Just because, I feel like it is a goal for a lot of people in this country to own their own business, I don't want to say like everybody, but like there's a lot of people who are interested in it. People want to live comfortably as, times get tougher and that kind of stuff. So I feel like that broadens the appeal a little bit as well. And some of those states are really cool. Move out to the middle of nowhere in, Arizona or whatever.
And piggybacking off of that, there's also a PA compact, which is being formed, which similar to the nursing compact allows one license to be carried over state lines. So maybe you're not ready to settle down or own a business. You still want to like get out and travel the world. That PA compact is going to allow you to work in all of those different states, not have to worry about licensure or fully committing to moving to that state that you want to experience, which I think is also really something cool that no other career gets. Like it's, you're nailed down to one spot once you take a job for most careers. And for PAs, that's coming to an end, I feel like, which is very cool.
It just feels like versatility is kind of like the name of the game for like the
Yeah.
profession as a whole, where you have so much choice and you have so much opportunity for growth, and the profession as a whole is growing. It's still changing. Like I said, legislation changes there every day, and it's been really exciting to kind of actually put a lens down and like look at those changes. Ever since I've really started this journey, and it makes me feel like I made the right decision. Maybe makes me feel like I'm. Like I said, we're at like the crest of a really interesting wave. So yeah.
Incredible. That seems like a great place to end. Shortcoats, if you have something you want to say about today's show, something you want to hear about someday, a question you have for us, go to theshortcoat.com/tell us and send us a message. Otherwise, that's our show. Until next time, I'm Dave Etler saying, don't let the bastards get you down. We'll see you later. Say bye.
Bye.
Thank you.